Hello, my name is
Hello.
Kaylee. I'm going to be doing a physical assessment on you today. Can you tell me your name and date of birth?
One Gill Mangus Day, January 26, 1993.
Okay, do you know where you are?
Springfield, Missouri.
Okay, what are we doing here?
I'm helping you with your assessment.
Yeah, and what day is it? Month. What month is it?
March.
Good job. Okay, you can come on and sit down. We'll go ahead and get started. Okay, and as you came in, I was assessing your general appearance. You don't have any obvious deformities, no involuntary movement. You have full range of motion from what it appeared as you were walking, and your hygiene seems appropriate. Your clothes are appropriate for the weather because it's springtime outside. It's nice. I also assess your level of consciousness. You're oriented ×4, and you're awake and alert. Your affect and mood are happy and calm and relaxed. Your skin tone your skin that I can assess from looking at you right now is consistent with your ethnicity, and I don't see any obvious deformities or lesions. No noted edema, but I'll be assessing your skin as we go on too. I also noted your nutritional status, that you appear to be nutritionally balanced. You don't look overweight or underweight. And we'll go ahead and get started on your assessment. So we'll start with your head. You're making eye contact with me. From what I can tell, everything seems symmetrical. I don't see any obvious deformities in your skull or your face. We already assessed your orientation and level of consciousness, so as with the whole assessment, I'm going to inspect and then palpate. So I'm going to go ahead and feel your head. I'm going to feel for all the, I'm going to feel for all of your cranial bones. Okay, I'm going to feel your mastoid processes. They're symmetrical. I'm going to assess your temporal arteries, strong and equal, your your temporomandibular joint, and go open your mouth and close it. Okay, they're symmetrical. I'm going to palpate your sinuses, any pressure, pain with that, tenderness. Okay, your face appears symmetrical. Can you smile for me? Okay, great. Your face and skull all seem good. I'm going to assess your eyes now. We'll start with just the regular eye test. So I'm just going to start by shining a light in your eye. So look right at me. We're going to assess your pupil reactions. Okay, I'll have you look at the pen light and then the wall behind me and back at the pen light. One more time. Okay, and I assess your corneal reflexes and all that good stuff, and your pupils are equal, round, reactive to light, and accommodate. I'm going to assess your fields of vision, all 6 cardinal fields, so I'll just have you follow my pen light as we go. Okay, I think I did more than 6, but that's okay. You're too good. And then we'll do the cover test, and we'll do this one a little bit differently. I'm just going to have you hold this over your eye, and look right at me and drop it down from your eye. Okay, and do the other eye the same way. Just assessing for a steady gaze. Okay, great. And I'm going to go ahead and come behind you, and I'm going to have you hold this over one eye again. And I'm going to have you tell me when you see my hands.
No. Okay. No. No. No.
Okay, and do the other eye.
No. No. No.
No. Okay, great. Now I'm going to look at the actual structure of your eye, your eyelids, eyelashes, eyebrows, and they all look symmetrical. I'm going to look in your eye a little bit, look up, there we go. I'm going to look at your conjunctiva, it should be clear, and it is. Around your eye is pink and moist, and you don't have any excessive dryness or anything like that. Your sclera is white. There's no discoloration. Your corneas are symmetrical and round, and your irides are symmetrical and they accommodate like we assessed earlier, and they're black on either side. So your eyes look great. In the clinical setting, we would also use the Snellen test, which is a visual acuity test, where you would stand 20 feet away, look at a chart with the letters big on the top and they get smaller as they go down, and have you read each line until you can't read it anymore, and that would test your visual acuity. So we'll just assume that you have 20/20 vision. Alright, now I'm going to assess your nose, start with inspection. It appears symmetrical. I don't see any obvious deviation. Have you ever broken your nose before? Okay, I'm going to assess the patency of your nair. Just breathe in and out. Okay, they're both pretty patent. I'm going to have you look up. And with the speculum I would look inside. But I'll assess the nasal passages, the lining of the nairs, and I would assess to see if it's pink and moist, and then I would also assess your septum for a deviation. I didn't notice any deviation. And looks pretty good. I'll go on to your mouth now. It looks symmetrical. I don't see any lesions on your mouth. I'll have you open up and say ah, ah. Okay, and I'll look all around, counting teeth as I go, looking at the buccal mucosa, pink and moist. Gums are pink and moist. The uvula is dangling. It's intact. It's mobile. And one more time, say ah, ah. And your sinuses I grade at a 2. They're visible, but they're not including your airway. I don't see any missing teeth or poor dental hygiene. You stick your tongue up for me and down. Okay. And the tongue looks good. The top is rough and the bottom is smooth and vascular. The roof of the mouth, both palates are intact and pink. The floor of the mouth is also pink and vascular, like the bottom of the tongue is. I'm going to assess your gag reflex too, since you can say ah, we'll assume you have a gag reflex. And your tongue is mobile and all that good stuff. Okay, we'll go ahead and move on to your neck. I'm going to assess your jugular veins one at a time. They're strong and equal. I'm going to have you lay against the back there. I'm going to assess for jugular vein distension. And you have negative jugular vein distension, so you're good. You can come sit back up. I'm also assessing for symmetry, and I'm going to have you move from right to left and up and down. Okay, you have symmetry of motion along your neck. I'm going to press against my hand. Okay, and the other way. And you have equal strength. Your accessory muscles are symmetrical. That all looks good. Now I'm going to palpate your lymph nodes. So we'll start up here using the flats of my fingers in a circular motion, trying to palpate any and all lymphatic tissue. I'm not able to palpate any lymph nodes. All non-palpable. Palpate your thyroid. I'm going to come behind. Your thyroid's non-palpable. I'm going to have you turn your head slightly to the left. I'm going to try to deviate your trachea. Okay, and the other way. Okay. There's no deviation in your trachea, and there's no enlargement of your thyroid, so that all looks good. No lymph node enlargement. Is there any tenderness when I was pressing a lymph node? No? Okay. We'll go ahead and move on to your chest. Starting again with inspection, I'm just going to watch your chest rise and fall and see that it's symmetrical. Have you sit up a little straighter. Okay. I can see that your thoracic cavity is symmetrical. There's no obvious deformities, no masses that I can see. That looks good. We'll go ahead and palpate and just feel for any masses or anything like that in your chest area. I'll just have you breathe in and out as I feel for symmetrical chest expansion. Again. I'll have you whisper 99. Okay. Okay. And alright, I'm going to go ahead and auscultate your lung sounds and listen for just going to listen in all of your lung fields. When I go to the back, I'll assess the rest. I'll be breathing in and out. Come to the back, and I'll do the same thing, inspect the thoracic cage, and I'm going to be say 99. Okay, symmetrical. I'm going to feel for symmetrical chest expansion by putting my hands on the back and thumbs next to the spine. Breathe in deep. Okay, symmetrical. I'm going to go ahead and listen to the back, posterior lung sounds. Just breathe in and out through your nose. Okay, now I'm going to have you say 99 out loud each time I touch you with the stethoscope.
99, 99, 99, 99, 99, 99,
Two more times.
99, 99.
Okay, I'm going to do the same thing on the front.
99, 99, 99, 99, 99, 99,
Lift your breasts for me, please. Thank you.
99, 99.
Okay. There's no sign of consolidation. Your voice tones are muffled and soft. Did you feel any tenderness when I was assessing you earlier? Okay, and I didn't feel any masses or anything like that. Your breath sounds are clear throughout, clear posteriorly and anteriorly. We will go ahead and move on to your heart. I'm going to listen to all four of the valves. I'm going to listen with my diaphragm in the bell. I'm going to listen to your atrial valve. Your pulmonic valve. Tricuspid. And if you lift your breasts, I'll listen to the apical. And here's where I would listen for a full minute and determine your heart rate. I hear S1 and S2 heart sounds, normal up dub. And I would do the same thing, listening with my bell in all four fields. And I forgot to assess your ears earlier, so I'm going to go ahead and do that. Do you have any hearing deficits on either side? No? Okay. With an otoscope, I would grab the pinna and pull up and back. You can't see this what I'm doing in the video, but I'm grabbing the pinna and pulling it up and back away from the head. I would then use my otoscope, which I don't have, to assess the ear canal. I would assess the canal itself and the eardrum, and the canal should be without lesions, and the ear canal should be a clear gray color, no drainage, no foreign bodies, and the other side should be symmetrical. And I do the same thing there, kind of up and back, and I would assess in the inner ear, looking for the same things. And then I'm also going to have you turn your head to the left, and I'm going to whisper something in your ear, and I want you to repeat it.
Baseball.
Okay, and then the other way.
99.
Okay, your hearing sounds good. Okay, we'll go ahead and move on to your abdomen. I'm going to have you lay down flat. There we go. Okay, and I'll have you lift your shirt if you're comfortable with that. I'll just get to the level and assess for the contour. It's flat. I'm also assessing symmetry right now. It is symmetrical on both sides. There's no masses or lesions that I can see. The skin is pink, consistent with ethnicity, but no lesions, nothing like that. The umbilicus is midline and inverted, and I don't see any pulsations. Now I'm going to palpate softly at first for tenderness. Any tenderness? No. Okay, I also don't feel any masses. Then I'm going to palpate deep under, sorry if you're ticklish, I'm going to palpate for the liver in the right upper quadrant. I'm going to have you breathe out slowly. In or out slowly. Okay, the liver's non-palpable. I'm going to assess for the spleen. Okay, spleen is non-palpable. Now I'm going to auscultate your bowel sounds in all four quadrants, listening for the normal tinklings, okay, you have normal active bowel sounds. I didn't hear any, I didn't hear any vascular sounds, no bruits or anything like that. Your abdomen looks good. We'll go ahead and move on to your musculoskeletal system, your extremities. We'll start with your upper extremities, so I'm going to have you sit up again. Okay, and I'm going to have you, first I'm going to assess your pulses, your radial pulses, strong and equal, and your brachial pulses. Are strong and equal. Okay. I'm going to have you stretch your arms out with your hands straight, and I want you to bend your wrists so that your fingers face down, and then up, and then point your fingers down, and then spread your fingers. Okay. Now make a fist, and then open, cross your thumb. Okay, it all looks good. I'm going to have you push against my hand. There we go. And then pull. No, sorry. Push. And then pull. Okay, and the other side. Push. And then pull. So your hand strength. Okay, looks good. I would also assess the color of your hands and your fingernails, and your fingernail bases. The nail beds are pink. Your capillary refill is less than 3 seconds. Skin color consistent with ethnicity. Again, skin pink and moist, smooth. Now I'm going to have you, push against my hand. We're assessing the strength of your arm. Okay, and pull. Now I'm just going to have you move your arm up and down. So you extend all the way. Moving your arm up here. Okay, up and down. There you go. And do with the other one. Okay, and assess for strength. And push against my arm. And pull. Okay. Alright. Looks good. I'm going to have you stand up now. We'll assess your shoulders, and I'm going to stand behind you. Well, I'm going to show you what to do first. So you'll start by swinging your arms up, and then back, and then up above your head, and then down. Okay?
Just
Somebody
exercise.
feel your shoulders. Yeah, up and back. All the way back behind you.
Oh.
There you go. And then up above your head to the sides. Okay, and then down. Bring them more like this. As in swing your arms above your head like that. There we go, and down. Okay. Now I want you to reach your hands to the back of your head and then to the below back of your shoulders while you do it. And then behind your back. Perfect. Okay. While we're standing up, we'll go ahead and move on to the lower extremities. And since your feet are already very close together, we'll go ahead and do the Romberg test. So I want you to face forward, look at something on the wall over there. Now I want you to close your eyes. I'm assessing for excessive swaying. The Romberg test is negative, so you're fine. Also, while we're standing up, I'll go ahead and assess the spine. I'm going to have you take a step forward for me so I can see behind you. I want you to bend your neck down, touch your chin to your chest. Okay? I'm going to feel your spine for any curvatures. The normal S. Okay, now I'm going to have you touch your toes as well as you can. Okay? Okay, you can stand back up. Now I want you to bend to the left and bend to the right. Now I want you to twist to the left and then twist to the right. Great job, okay. Your spine looks really good. I'll go ahead and have you lay back down and we'll look at your legs. Okay. It's okay. I just need to assess for skin color and all of that. I'm going to assess your popliteal, your pulses, your popliteal pulses, and they're strong and equal. Assess your posterior tibial pulses, also strong and equal. Strong and equal. Okay, now I'm going to have you push against my hands and pull. Okay, you have equal strength. Have you lift one leg at a time. Okay, down. Up the other one. There we go. Down. I want you to do the same thing, only bend your knee this time. Okay, and down. Assessing range of motion now in this foot. Excellent. We're assessing your hips right now. So now I'm going to have you put one foot right here. Okay, I want you to bend your knee out and then in. Great, now do that with the other one. Out and in. Cross over. Okay, great. Now I want you to spread this leg as far as it'll go to the side. Okay, that's plenty. So make sure you can adduct and abduct. Now go over your other foot with it. Okay, great. I want you to try and do the same with the other leg. Adduct it. Yeah, you're kind of going up with it, but I think we know that you can abduct. There you go. Now bring it over the top of the other one. Okay, great. And come back. Okay, and we already saw that you can flex and extend your knees. Now I'm going to assess your ankles. I just want you to push your feet forward and back. Okay, flex and extend, and then we'll rotate internally and externally. Great, looks good. I've probably been blocking your feet the whole time, but okay, we'll assist all of that. We did the Romberg's test, and so now we'll move on. I'm going to do the Babinski test. Probably gonna tickle a little bit, but it's okay. You just relax your foot. Okay. Okay. You have a negative Pavinsky. Now move on to, see if there's any other neuromuscular things that we need to do. Assess your spine. Okay, we'll go ahead and move on to your neurological system now. So, I'm going to assess your reflexes. So go ahead and sit up for me. While your leg is dangling, just relax your legs. Relax your legs. Okay, go and relax. And I would be using a reflex hammer. I don't have one of those, so I'll just use my knuckles. Go ahead and assess your reflexes. Okay. I'll do it on the other side as well. Just relax. Okay, great. Then we'll assess your the reflex in your arm. So relax your arm. Okay. Look at this one. Just relax your arm in my hand. Hold on, you wait. Okay. And then we'll assess your Achilles, which you'll have to lay back down again for. I want you to kind of bend one knee and cross it over the other, your ankle. Just your ankle. Just like that. We're assessing the Achilles. Reflex now. Okay, we'll do the other leg. Want it totally relaxed. Okay. Alright. We assess your reflexes. Now we're going to assess your sensation. So I have two objects, one sharp and one soft, and I'm going to assess on your face, hands, legs, and feet. So I want you to close your eyes and tell me if you feel soft or sharp.
Sharp.
Okay.
Soft.
All right.
Soft. Sharp.
Okay. And your hands now.
Sharp. Sharp. Soft. Sharp. Soft.
Okay.
Sharp. Soft. Soft. Sharp.
Okay.
Sharp. Soft. Sharp. Soft.
Okay. I'm also going to assess your hands. I want you to tell me which direction your finger is being moved to, up or down.
Down.
Okay.
Up.
Okay. And the other side.
Down. Up.
Okay. Great. Okay. You can go ahead and sit up. Just thinking through. Logical exam. We assessed for sensation. You have full range of motion everywhere. Skin color looked great everywhere we looked. Okay. Do you have any questions?
I don't think so.
Okay, we'll go ahead and end our assessment. Thank you so much.
Thank you.